This was the dream of Robert and Lynette Gay as they began plans in 2011 to build a world-class school of public health. Fortunate to find a partner in Kwame Nkrumah University of Science and Technology and the University of Utah School of Public Health, Ensign College of Public Health was created from funds donated by people who also believe in the desire to raise healthcare standards in West Africa. Ensign College is situated on a beautiful piece of land adjacent to the Volta River. The college not only designed to be aesthetically pleasing, but also to house learning spaces that blend the highest standards of technology and scholarship.
So with the accelerated movement of people and cultures and ideas everywhere in the wake of globalization, I strongly think that quality education is not something to be compromised. And for me, my expectations have been met because I believe that educational institutions are supposed to provide a platform where the creative capacity of students are launched. And thankfully at Ensign, they have all it takes for your creativity to come to bear. At Ensign, there are a lot of community projects, and some of these projects allow students to actively participate. And the beautiful part is where students actually lead some of these programs and discussions. I think professionalism and leadership is a core competence in public health, and that's exactly what Ensign offers its students.
I chose Ensign College of Public Health to acquire a master's degree in public health to enhance my practice, especially in preventing diseases and promoting health. The experience so far at Ensign has been one of my best in any educational institution. I have experienced the best faculty so far in their delivery of their course content, in helping you to appreciate how the course is related to your subsequent practice should you graduate. Ensign College has a mark of excellence in all of its departments. In the classroom, there is that mark of excellence. In the cafeteria, there is that mark of excellence. In the facility management, there is that mark of excellence. In the hostel also, there is that mark of excellence. The experience at Ensign, the environment also being conducive for learning. I would encourage anyone out there who is interested in changing lives from a public health perspective to choose Ensign College, because Ensign College has the best facility, the best environment, and the best faculty for public health education.
Personally, I would say Ensign College of Public Health is the place to be for anyone who would want to be a professional in public health. I would recommend anyone to come to Ensign College of Public Health, because Ensign College of Public Health packages courses that can make one a proficient in public health.
I chose Ensign because after my inquiry, I realized that they're a focused school. Their focus is all on public health. This gave me the impression that they pay more attention in that particular subject, so there's no deviation here or there. And then I also realized that the number of students they take per year is quite limited, which means that there's a lot of interaction. Lecturers are able to have more time for students, so that is why I chose public health. So far, it's been awesome. The second years, the lecturers, the staff is an awesome family.
This was the dream of Robert and Lynette Gay as they began plans in 2011 to build a world-class school of public health. Fortunate to find a partner in Kwame Nkrumah University of Science and Technology and the University of Utah School of Public Health, Ensign College of Public Health was created from funds donated by people who also believe in the desire to raise healthcare standards in West Africa. Ensign College is situated on a beautiful piece of land adjacent to the Volta River. The college not only designed to be aesthetically pleasing, but also This was the dream of Robert and Lynette Gay as they began plans in 2011 to build a world-class school of public health. Fortunate to find a partner in Kwame Nkrumah University of Science and Technology and the University of Utah School of Public Health, Ensign College of Public Health was created from funds donated by people who also believe in the desire to raise healthcare standards in West Africa. Ensign College is situated on a beautiful piece of land adjacent to the Volta River. The college not only designed to be aesthetically pleasing, but also to house learning spaces that blend the highest standards of technology and scholarship. This was the dream of Robert and Lynette Gay as they began plans in 2011 to build a world-class school of public health. Fortunate to find a partner in Kwame Nkrumah University of Science and Technology and the University of Utah School of Public Health, Ensign College of Public Health was created from funds donated by people who also believe in the desire to raise healthcare standards in West Africa. Ensign College is situated on a beautiful piece of land adjacent to the Volta River. The college not only designed to be aesthetically pleasing, but also to house learning spaces that blend the highest standards of technology and scholarship.
So with the accelerated movement of people and cultures and ideas everywhere in the wake of globalization, I strongly think that quality education is not something to be compromised. And for me, my expectations have been met because I believe that educational institutions are supposed to provide a platform where the creative capacity of students are launched. And thankfully at Ensign, they have all it takes for your creativity to come to bear. At Ensign, there are a lot of community projects, and some of these projects allow students to actively participate. And the beautiful part is where students actually lead some of these programs and discussions. I think professionalism and leadership is a core competence in public health, and that's exactly what Ensign offers its students.
I chose Ensign College of Public Health to acquire a master's degree in public health to enhance my practice, especially in preventing diseases and promoting health. The experience so far at Ensign has been one of my best in any educational institution. I have experienced the best faculty so far in their delivery of their course content, in helping you to appreciate how the course is related to your subsequent practice should you graduate. Ensign College has a mark of excellence in all of its departments. In the classroom, there is that mark of excellence. In the cafeteria, there is that mark of excellence. In the facility management, there is that mark of excellence. In the hostel also, there is that mark of excellence. The experience at Ensign, the environment also being conducive for learning. I would encourage anyone out there who is interested in changing lives from a public health perspective to choose Ensign College, because Ensign College has the best facility, the best environment, and the best faculty for public health education.
Personally, I would say Ensign College of Public Health is the place to be for anyone who would want to be a professional in public health. I would recommend anyone to come to Ensign College of Public Health, because Ensign College of Public Health packages courses that can make one a proficient in public health.
I chose Ensign because after my inquiry, I realized that they're a focused school. Their focus is all on public health. This gave me the impression that they pay more attention in that particular subject, so there's no deviation here or there. And then I also realized that the number of students they take per year is quite limited, which means that there's a lot of interaction. Lecturers are able to have more time for students, so that is why I chose public health. So far, it's been awesome. The second years, the lecturers, the staff is an awesome family.
This was the dream of Robert and Lynette Gay as they began plans in 2011 to build a world-class school of public health. Fortunate to find a partner in Kwame Nkrumah University of Science and Technology and the University of Utah School of Public Health, Ensign College of Public Health was created from funds donated by people who also believe in the desire to raise healthcare standards in West Africa. Ensign College is situated on a beautiful piece of land adjacent to the Volta River. The college not only designed to be aesthetically pleasing, but also to house learning spaces that blend the highest standards of technology and scholarship.
So with the accelerated movement of people and cultures and ideas everywhere in the wake of globalization, I strongly think that quality education is not something to be compromised. And for me, my expectations have been met, because I believe that educational institutions are supposed to provide a platform where the creative capacity of students are launched. And thankfully at Ensign, they have all it takes for your creativity to come to bear. At Ensign, there are a lot of community projects, and some of these projects allow students to actively participate. And the beautiful part is where students actually lead some of these programs and discussions. I think professionalism and leadership is a core competence in public health, and that's exactly what Ensign offers its students.
I chose Ensign College of Public Health to acquire a master's degree in public health to enhance my practice, especially in preventing diseases and promoting health. The experience so far at Ensign has been one of my best in any educational institution. I have experienced the best faculty so far in their delivery of their course content, in helping you to appreciate how the course is related to your subsequent practice should you graduate. Ensign College has a mark of excellence in all of its departments. In the classroom, there is that mark of excellence. In the cafeteria, there is that mark of excellence. In the facility management, there is that mark of excellence. In the hostel also, there is that mark of excellence. The experience at Ensign, the environment also being conducive for learning. I would encourage anyone out there who is interested in changing lives from a public health perspective to choose Ensign College, because Ensign College has the best facility, the best environment, and the best faculty for public health education.
Personally, I would say Ensign College of Public Health is the place to be for anyone who would want to be a professional in public health. I would recommend anyone to come to Ensign College of Public Health, because Ensign College of Public Health packages courses that can make one a proficient in public health.
I chose Ensign because after my inquiry, I realized that they're a focused school. Their focus is all on public health. This gave me the impression that they pay more attention in that particular subject, so there's no deviation here or there. And then I also realized that the number of students they take per year is quite limited, which means that there's a lot of interaction. Lecturers are able to have more time for students, so that is why I chose public health. So far, it's been awesome. The second years, the lecturers, the staff is an awesome family.
This was the dream of Robert and Lynette Gay as they began plans in 2011 to build a world-class school of public health. Fortunate to find a partner in Kwame Nkrumah University of Science and Technology and the University of Utah School of Public Health, Ensign College of Public Health was created from funds donated by people who also believe in the desire to raise healthcare standards in West Africa. Ensign College is situated on a beautiful piece of land adjacent to the Volta River. The college not only designed to be aesthetically pleasing, but also to house learning spaces that blend the highest standards of technology and scholarship.
So with the accelerated movement of people and cultures and ideas everywhere in the wake of globalization, I strongly think that quality education is not something to be compromised. And for me, my expectations have been met, because I believe that educational institutions are supposed to provide a platform where the creative capacity of students are launched. And thankfully at Ensign, they have all it takes for your creativity to come to bear. At Ensign, there are a lot of community projects, and some of these projects allow students to actively participate. And the beautiful part is where students actually lead some of these programs and discussions. I think professionalism and leadership is a core competency in public health, and that's exactly what Ensign offers its students.
I chose Ensign College of Public Health to acquire a master's degree in public health to enhance my practice, especially in preventing diseases and promoting health. The experience so far at Ensign has been one of my best in any educational institution. I have experienced the best faculty so far in their delivery of their course content, in helping you to appreciate how the course is related to your subsequent practice should you graduate. Ensign College has a mark of excellence in all of its departments. In the classroom, there is that mark of excellence. In the cafeteria, there is that mark of excellence. In the facility management, there is that mark of excellence. In the hostel also, there is that mark of excellence. The experience at Ensign, the environment also being conducive for learning. I would encourage anyone out there who is interested in changing lives from a public health perspective to choose Ensign College, because Ensign College has the best facility, the best environment, and the best faculty for public health education.
Personally, I would say Ensign College of Public Health is the place to be for anyone who would want to be a professional in public health. I would recommend anyone to come to Ensign College of Public Health, because Ensign College of Public Health packages courses that can make one a proficient in public health.
I chose Ensign because after my inquiry, I realized that they're a focused school. Their focus is all on public health. This gave me the impression that they pay more attention in that particular subject, so there's no deviation here or there. And then I also realized that the number of students they take per year is quite limited, which means that there's a lot of interaction. Lecturers are able to have more time for students, so that is why I chose public health. So far, it's been awesome. The second years, the lecturers, the staff is an awesome family.
This was the dream of Robert and Lynette Gay as they began plans in 2011 to build a world-class school of public health. Fortunate to find a partner in Kwame Nkrumah University of Science and Technology and the University of Utah School of Public Health, Ensign College of Public Health was created from funds donated by people who also believe in the desire to raise healthcare standards in West Africa. Ensign College is situated on a beautiful piece of land adjacent to the Volta River. The college not only designed to be aesthetically pleasing, but also to house learning spaces that blend the highest standards of technology and scholarship.
So with the accelerated movement of people and cultures and ideas everywhere in the wake of globalization, I strongly think that quality education is not something to be compromised. And for me, my expectations have been met because I believe that educational institutions are supposed to provide a platform where the creative capacity of students are launched. And thankfully at Ensign, they have all it takes for your creativity to come to bear. At Ensign, there are a lot of community projects, and some of these projects allow students to actively participate. And the beautiful part is where students actually lead some of these programs and discussions. I think professionalism and leadership is a core competence in public health, and that's exactly what Ensign offers its students.
I chose Ensign College of Public Health to acquire a master's degree in public health to enhance my practice, especially in preventing diseases and promoting health. The experience so far at Ensign has been one of my best in any educational institution. I have experienced the best faculty so far in their delivery of their course content, in helping you to appreciate how the course is related to your subsequent practice should you graduate. Ensign College has a mark of excellence in all of its departments. In the classroom, there is that mark of excellence. In the cafeteria, there is that mark of excellence. In the facility management, there is that mark of excellence. In the hostel also, there is that mark of excellence. The experience at Ensign, the environment also being conducive for learning. I would encourage anyone out there who is interested in changing lives from a public health perspective to choose Ensign College, because Ensign College has the best facility, the best environment, and the best faculty for public health education.
Personally, I would say Ensign College of Public Health is the place to be for anyone who would want to be a professional in public health. I would recommend anyone to come to Ensign College of Public Health, because Ensign College of Public Health packages courses that can make one a proficient in public health.
I chose Ensign because after my inquiry, I realized that they're a focused school. Their focus is all on public health. This gave me the impression that they pay more attention in that particular subject, so there's no deviation here or there. And then I also realized that the number of students they take per year is quite limited, which means that there's a lot of interaction. Lecturers are able to have more time for students, so that is why I chose public health. So far, it's been awesome. The second years, the lecturers, the staff is an awesome family.
This was the dream of Robert and Lynette Gay as they began plans in 2011 to build a world-class school of public health. Fortunate to find a partner in Kwame Nkrumah University of Science and Technology and the University of Utah School of Public Health, Ensign College of Public Health was created from funds donated by people who also believe in the desire to raise healthcare standards in West Africa. Ensign College is situated on a beautiful piece of land adjacent to the Volta River. The college not only designed to be aesthetically pleasing, but also to house learning spaces that blend the highest standards of technology and scholarship.
So with the accelerated movement of people and cultures and ideas everywhere in the wake of globalization, I strongly think that quality education is not something to be compromised. And for me, my expectations have been met because I believe that educational institutions are supposed to provide a platform where the creative capacity of students are launched. And thankfully at Ensign, they have all it takes for your creativity to come to bear. At Ensign, there are a lot of community projects, and some of these projects allow students to actively participate. And the beautiful part is where students actually lead some of these programs and discussions. I think professionalism and leadership is a core competency in public health, and that's exactly what Ensign offers its students.
I chose Ensign College of Public Health to acquire a master's degree in public health to enhance my practice, especially in preventing diseases and promoting health. The experience so far at Ensign has been one of my best in any educational institution. I have experienced the best faculty so far in their delivery of their course content, in helping you to appreciate how the course is related to your subsequent practice should you graduate. Ensign College has a mark of excellence in all of its departments. In the classroom, there is that mark of excellence. In the cafeteria, there is that mark of excellence. In the facility management, there is that mark of excellence. In the hostel also, there is that mark of excellence. The experience at Ensign, the environment also being conducive for learning. I would encourage anyone out there who is interested in changing lives from a public health perspective to choose Ensign College, because Ensign College has the best facility, the best environment, and the best faculty for public health education.
Personally, I would say Ensign College of Public Health is the place to be for anyone who would want to be a professional in public health. I would recommend anyone to come to Ensign College of Public Health, because Ensign College of Public Health packages courses that can make one a proficient in public health.
I chose Ensign because after my inquiry, I realized that they're a focused school. Their focus is all on public health. This gave me the impression that they pay more attention in that particular subject, so there's no deviation here or there. And then I also realized that the number of students they take per year is quite limited, which means that there's a lot of interaction. Lecturers are able to have more time for students, so that is why I chose public health. So far, it's been awesome. The second years, the lecturers, the staff is an awesome family.
This was the dream of Robert and Lynette Gay as they began plans in 2011 to build a world-class school of public health. Fortunate to find a partner in Kwame Nkrumah University of Science and Technology and the University of Utah School of Public Health, Ensign College of Public Health was created from funds donated by people who also believe in the desire to raise healthcare standards in West Africa. Ensign College is situated on a beautiful piece of land adjacent to the Volta River. The college not only designed to be aesthetically pleasing, but also to house learning spaces that blend the highest standards of technology and scholarship.
So with the accelerated movement of people and cultures and ideas everywhere in the wake of globalization, I strongly think that quality education is not something to be compromised. And for me, my expectations have been met because I believe that educational institutions are supposed to provide a platform where the creative capacity of students are launched. And thankfully at Ensign, they have all it takes for your creativity to come to bear. At Ensign, there are a lot of community projects, and some of these projects allow students to actively participate. And the beautiful part is where students actually lead some of these programs and discussions. I think professionalism and leadership is a core competence in public health, and that's exactly what Ensign offers its students.
I chose Ensign College of Public Health to acquire a master's degree in public health to enhance my practice, especially in preventing diseases and promoting health. The experience so far at Ensign has been one of my best in any educational institution. I have experienced the best faculty so far in their delivery of their course content, in helping you to appreciate how the course is related to your subsequent practice should you graduate. Ensign College has a mark of excellence in all of its departments. In the classroom, there is that mark of excellence. In the cafeteria, there is that mark of excellence. In the facility management, there is that mark of excellence. In the hostel also, there is that mark of excellence. The experience at Ensign, the environment also being conducive for learning. I would encourage anyone out there who is interested in changing lives from a public health perspective to choose Ensign College, because Ensign College has the best facility, the best environment, and the best faculty for public health education.
Personally, I would say Ensign College of Public Health is the place to be for anyone who would want to be a professional in public health. I would recommend anyone to come to Ensign College of Public Health, because Ensign College of Public Health packages courses that can make one a proficient in public health.
I chose Ensign because after my inquiry, I realized that they're a focused school. Their focus is all on public health. This gave me the impression that they pay more attention in that particular subject, so there's no deviation here or there. And then I also realized that the number of students they take per year is quite limited, which means that there's a lot of interaction. Lecturers are able to have more time for students, so that is why I chose public health. So far, it's been awesome. The second years, the lecturers, the staff is an awesome family.
This was the dream of Robert and Lynette Gay as they began plans in 2011 to build a world-class school of public health. Fortunate to find a partner in Kwame Nkrumah University of Science and Technology and the University of Utah School of Public Health, Ensign College of Public Health was created from funds donated by people who also believe in the desire to raise healthcare standards in West Africa.
Okay, thank you. You are all welcome. We will sing the first stanza of Yenara Yasasini, accompanied by the pre-recorded version, after which I will invite Mr. Cyril Mensah to offer the invocation.
Our Father who art in heaven, on this Saturday late afternoon, we bow our heads before Thee in appreciation for this sixth congregation of the faith cohort who are gathered here to graduate after a series and periods of study. We are grateful that their academic endeavors have come to a successful end. We are grateful for all the guests, professors, and doctors and keynote speakers who are here gathered to deliver great inspiring messages. We commit our graduates into Thy hands. As they embark into the professional and career world, we seek progress for them. May this graduation bring to them many blessed opportunities now and in the future. That Ensign, which is high hosted to be a standard bearer, will be sustained through time. For all our speakers, we ask that Thou will touch their hearts and touch their lips and tongues, that they will speak inspiring words to all who hear them at the sound of their voices. May Thy Spirit take charge of the affairs of this day. It's a humble prayer we request. In the name of our Savior, Jesus Christ. Amen.
Please be seated. Thank you, Mr. Mensah. The board chair, members of the Board of Governors, the president, staff, students of Ensign College of Public Health, invited guests, ladies and gentlemen, and all those who are joining us live on the internet. On behalf of the management and leadership of the board, I welcome you all to the fifth congregation of the college. We are here to witness the conferment of Master of Public Health degree on these candidates of the fifth cohort of the program. Kindly note that we are in unusual times, and as such, all COVID-19 preventive protocols will be observed at all times. Ladies and gentlemen, may I now invite the registrar, Mr. Patrick Kumar, who shall moderate the remaining proceedings of the graduation ceremony. Mr. Kumar.
Good afternoon, distinguished ladies and gentlemen. On behalf of management, I welcome you all to the fifth congregation ceremony of the Ensign College of Public Health. Although it is the fifth, it is the first to be organized both virtually and in person. The founder and chair of the board of directors, Dr. and Mrs. Leonard Gay, as well as the president, are participating in this event virtually from the United States of America. Again, it is the first congregation to be organized in a pandemic. May I remind you all that although our campus is currently a COVID-19 free environment, we will still have to observe protocols to ensure that the spread is kept. In your brochure, you have a copy of this to remind you of the protocols we want you to observe. At this point, may I respectfully invite the chair and founder, the chair of the Board of Governors, to officially welcome you and constitute the assembly. Mrs. Gay.
Thank you very much. It is indeed a tremendous pleasure to meet with you. Of course, we wish we could be together in person, but I'm so grateful for technology that allows this to take place, that we can still see face to face and join in together in this wonderful graduation ceremony. And I'd like to welcome everyone. I would especially like to welcome our special guest and the keynote speaker, Dr. Elakim Tamaklo, our fellow members of the Board of Governors, Professor Cherry Abanyega, and the Vice Chair, Professor Ajimana Kosa, Professor Christian Agari, Provost from the College of Health and Science, representing the Vice Chancellors of KNUST, the Executive Secretary of the National Accreditation Board, Representative Yvette Asofo Ajay, all the members of the convocation, all parents, guardians, spouses, staff, student alumni, graduating students, of course, and all invited guests, distinguished ladies and gentlemen. I warmly welcome and extend my greetings and best wishes to all gathered here for the 5th congregation of the Ensign College of Public Health, and to preside over this assembly as the chair of the Board of Governors for the confirmation of Masters of Public Health degree under you deserving students of the 5th cohort admitted into Ensign College in 2018. And I probably had met several of you at that time 2 years ago, and it's amazing those 2 years have gone by. But today's ceremony is very significant in that it is the culmination of these 2 years of hard work and serious studies by our graduates. And I take this opportunity to congratulate each and every one of you. We all share in your joy after successfully completing this program and are extremely proud of all of your accomplishments, especially given the circumstances that this year has ended up in. I also want to acknowledge every parent, guardian, spouse, lecturer, staff, and all who have contributed one way or another to the success of these students who are graduating today. Your work and sacrifices have been tremendous. I'll forever be grateful to our very talented and tireless staff and faculty at Ensign, Dr. Manatee, Dr. Sutherland, and Dr. Asina, as well as our adjunct professors, Mr. Patrick Kuma, the Ensign's registrar, and the entire staff on board at campus. Since neither President Alder or myself or any of the United States Ensign team have been able to be there on campus at all this year, and there has been a tremendous amount of work and effort and diligence given from the staff there on campus. And I think all of you can see the beauty that continues to remain amidst all of the constraints and all of the preparation efforts that have gone into this graduation. And I'm so very thankful to each one of you there. At this time, I would like to constitute our assembly here that is gathered. Now, distinguished guests, ladies and gentlemen, by the powers conferred on me, Lynette Gay, founder and board chair of Ensign College of Public Health, I am delighted to declare this assembly duly constituted for the award of Masters of Public Health degrees to all successful graduates. Thank you.
Thank you, Dr. Mrs. Gay. We will continue with the program by inviting the immediate past Ensign College of Public Health LSRC President, Mr. George Opon Menu.
The Board of Governors, all protocols observed. Ladies and gentlemen, I'm grateful to be here today to deliver this report as the outgoing SRC president of this noble institution. The journey was not a smooth sail, but by the grace and mercies of the Almighty God, we have arrived at the docks, and I would like to appreciate the entire Ensign community. We came into office on the 16th of December, 2018. As a team, we analyzed how far the SRC had come and what we would do to continue the good works of our predecessors. We have made significant strides as an SRC. During our tenure of office, we facilitated SRC activities by procuring a state-of-the-art i5 Dell computer, a printer, and 2 mobile phones for the SRC office. This enabled the SRC to efficiently keep records and effectively manage communications within the student body. This would definitely boost the future SRC activities for generations to come. Our SRC also participated in the Maiden Health Policy Lab for graduate public health students, organized by the TU Berlin, KNUST School of Public Health, and other partners on the theme, Redefining Primary Health Care for Universal Coverage at Aqua Safari. And I'm glad to report that the Ensign College of Public Health, SRC, actively contributed to the discussions at this event. Ensign was duly recognized out of all the schools present for a strong participation. On campus, we have assisted in promoting educational field trips organized by the faculty. We had an interesting field trip to the Public Health Department of the Volta River Authority at Akosombo to expand our knowledge on schistosomiasis, a prevalent and endemic neglected tropical disease in Ghana, as well as Africa. This was followed by visits to a reverend community to assess primary school children with the disease. This is just to mention a few of our achievements. Last but not the least, we nurtured the concept of SRC dues collection to sustain our activities. This recommendation, passed on to our strong and able successors, has come to fruition. The SRC has grown stronger than before. In conclusion, I would like to testify that the open door policy of this institution could not have been any better. Students can literally walk into any office at any point in time and have their concerns aptly addressed. I would like to strongly commend all faculty and staff at the Ensign College of Public Health for their devotion and dedication. And to our founder, the board chair, and partnering institutions, we are forever grateful for your benevolence and support. With a common voice, we say thank you to Ensign Public Health. There is an African proverb that says that if you want to go fast, go alone, but if you want to go far, go together. I'm glad Cohort 5 has come this far together, and I believe that we will soar higher and higher. I would like to end my speech with a quote from Psalm 118, verse 24. The King James Version reads, "This is the day which the Lord hath made. We will rejoice and be glad in it." Thanks, and God bless us all. Long live SRC, long live Ensign, long live Ghana.
Thank you, outgoing SRC President. No, you have actually left the system, so let me correct that. Ladies and gentlemen, we will continue with the program by listening to the President's address. Professor Stephen Alder, please take over.
Thank you very much, Mr. Kuma. And I want to echo our board chair, Lynette Gay's sentiments, how I wish I could be there with you today. And we sorely miss you and look forward to those times when we can reunite. The chairperson, Dr. Lynette Gay, and members of the Board of Governors, Ensign College of Public Health, Provost, College of Health Sciences, Professor Christian Ajari, representing the Vice Chancellor, Kwame Nkrumah University of Science and Technology. The keynote speaker, the Managing Director of the Nyaho Medical Center, Dr. Elikem Tamaklo. The Executive Secretary, Municipal and District Directors of Health Services in Ghana. Heads, friends, and representatives from various tertiary and partner institutions. Representatives of the University of Utah. Faculty, staff, students, and alumni of Ensign College of Public Health, and most importantly, graduates, distinguished invited guests, ladies and gentlemen. It is an honor to warmly welcome you all to the 5th congregation of Ensign College of Public Health on behalf of the Board of Governors, faculty, staff, and students. I wish to also welcome the graduating class, their family and friends who have supported and stood by them through their education and are here to see them finally graduate. I particularly want to acknowledge Drs. Lynette and Robert Gay for their extensive effort they and our collaborators from KNUST and the University of Utah in the United States of America have made to ensure that this ceremony takes place as scheduled. I especially welcome our distinguished keynote speaker, Dr. Elikem Tamaklo, the Managing Director of the Nyaho Medical Center, as well as Professor Christian Najari from KNUST and members of our Board of Governors, who are all present in our midst despite their busy and engaging schedules. Today we mark the completion of the 6th year of Ensign College of Public Health. It is with great appreciation that we also mark 6 years of affiliation with KNUST and express our gratitude for their mentoring and support. We continue to enjoy the benefits of this world-class campus and the beauty that surrounds it. We are grateful to all our excellent faculty, students, staff, and partners who make Ensign College of Public Health a preeminent academic institution. Our graduation falls in the midst of a worldwide pandemic. As we celebrate, we know that SARS-CoV-2, the virus that causes COVID-19, is spreading throughout the world. In public health, we know that health is more than the absence of disease, but it is the capacity and opportunity to live well. And for a time, COVID-19 is challenging many around the world to do so. Not only do we know of the mortality and morbidity impacts that have been the centerpiece of public health since the inception of this field, we also know that this pandemic has caused economic disruption, political strife, and personal despair. Let me come back to this topic later in my remarks. The word ensign refers to a symbol, often a banner or flag that is raised in a high place around which people can gather to join in a higher cause or pursue a noble vision. The noble vision of Ensign College of Public Health is to be a distinguished, standard-bearing institution for developing public health leaders who will engage communities in promoting healthy lifestyles in Ghana the West African region, and beyond. The mission of the Ensign College of Public Health is to produce, share, and implement knowledge and train leaders to promote community health and prevent disease through equitable partnerships. We emphasize community engagement, leadership, innovation and entrepreneurship, and professionalism. Our founder and chair of our board of governors, Lynette Gay, has charged us to improve health and well-being in Ghana, in West Africa, and throughout the world by developing community-oriented public health professionals who will be leaders that will join us in advancing the science and practice of public health. She consistently reminds us that Ensign College of Public Health is only successful when our efforts make positive differences in the lives of people, their families, and their communities. At Ensign College of Public Health, we are committed to a principled approach to improving quality of life for people and their communities. We engage in equitable partnerships with individuals, communities, and practitioners. We strive for excellence and innovation in education, research, and service. We are guided by ethical principles in our teaching, research, and practice. We believe in health equity for all people. Public health is an academic and professional field dedicated to identifying the challenges to the health of the population, followed by the development and implementation of solutions to these challenges. While many of these solutions are technical in nature, most require the engagement of the public and motivating changes in practices and behaviors. This is why we emphasize the need for our graduates to be leaders. The practice and science of public health depends on our ability to help people achieve their potential, to help them be greater than they realize is possible. We find ourselves as practitioners of public health facing one of the great challenges of our time. SARS-CoV-2 is contagious and threatens individuals throughout the world, regardless of age, sex, race, or economic status. In a way, it emphasizes the common bond we share as humanity. While we live in a world that too often focuses on our differences, the COVID-19 pandemic reminds us that, in fact, we are actually quite similar. Because this virus is infective, it is a burden borne by communities, and as such, it is managed best when we work together. Could it be that as a member of this great Ensign College of Public Health family, we can be agents of peace and unity as we encourage those within our spheres of influence to work together for the common good of eradicating COVID-19? Yet, why should we stop there? The best of what the field of public health offers and what the great institution we call Ensign College of Public Health was established to accomplish is bringing about health, peace, and prosperity. 50 years ago, I was a young child. From my childhood, I have the faintest memories of the great achievement of the Apollo 11 mission landing on the moon in July 1969. This achievement was not easy. In fact, it was extremely difficult. In a speech given at Rice University on September 12, 1962, then U.S. President John F. Kennedy gave the challenge to reach the moon within the decade. In his speech, he gave examples of the Atlantic Ocean for people to take great risks to climb the highest mountain, and yes, to successfully send astronauts to the moon. Of these challenges, he stated, "We chose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard, because that goal will serve to organize and measure the best of our energies and skills, because that challenge is one that we are willing to accept, one we are unwilling to postpone, and one we intend to win, and the others too." A few years ago, Ensign College of Public Health was just a concept. A decision was made by a small group of people to make the concept of Ensign College of Public Health a reality. We knew this would be hard, but honestly, we had no idea how hard. We had no way of knowing that with almost no notice, we would be asked to close our campus in support of the national effort to control the spread of SARS-CoV-2. We had no way of knowing that over a period of a few days, we would need to shift our entire curriculum to be delivered online. We did not realize that so many of our Ensign family who were already sacrificing to support this institution would be asked to do more, including you, our esteemed graduates, who will hold historical significance as the cohort who persevered through the challenges of the COVID-19 pandemic. Our challenges give us the chance to find better ways, stretch our capacity, and expand our vision. We have seen exceptional progress over the past 6 years with an established graduate program in public health, graduates who are applying the knowledge and skills they developed to students on the greatest public health challenges we face today, valued mentoring by KNUST, and expanding partnerships that allow us to have ever greater impact on improving lives. We are guided by revered visionaries such as the chair of our Board of Governors, Lynette Gay, who along with her husband, Elder Robert Gay, have given us the challenge and support to make the world a better place. We sit in the midst of proof that even when something is difficult, that even when we are faced with great challenges, with perseverance that comes from a commitment to make a difference for good, we can do great things. My charge to Ensign College of Public Health graduating class of 2020 is to embrace challenges, recognize that challenges are opportunities to find the greatness within us and to use that greatness to make the world a better, more peaceful, and more prosperous place. Your education at Ensign College of Public Health has instilled in you that your success is inextricably linked to how you can help those around you find greatness in themselves. For this is what it means to be a leader. Graduates, you have been provided with an exceptional education that has included classroom instruction by skilled teachers, field placements that have given you experience in the practical application of public health, and the completion of thesis projects where you have deepened your knowledge through research. Your shared educational pathway has come to an end, and now you formally join a global public health workforce that is dedicated to making a better world. We know that COVID-19 is not the only challenge we now face. We are charged to embark on the never-ending pursuit of boldly facing all challenges that stand in the way of health and prosperity. How do we assure that everyone has access to the resources needed to stay healthy and well? How do we stop the worldwide effects of diseases like malaria, pneumonia, and tuberculosis? How do we create the conditions that allow safety in workplaces, fewer traffic-related injuries, and homes free of hazards? How do we ensure that physical activity and healthy eating continue even when development leads to more sedentary occupations and availability of unhealthy food options? How do we support mothers during pregnancy and children during the vulnerable first 5 years of life? How do we ensure that everyone can be productively engaged in creating the conditions for peaceful and prosperous communities? These and many others are the challenges we are committed to face, yet we did not choose the field of public health because it was easy. We chose it because these challenges are hard, and we have accepted the call to find the greatness within ourselves to do hard things. I challenge each of you to commit to taking what you have gained at Ensign College of Public Health and use it to change the world for good. Dedicate yourself to be one who embraces the challenges that you will face and becomes defined by being noble and great as you tenaciously find the way forward. I will end as I do each year with a quote from Dr. Kwame Nkrumah in his address to the National Assembly of Ghana on the 12th of June, 1965. Quote, "Countrymen, the task ahead is great indeed, and heavy is the responsibility, and yet it is a noble and glorious challenge, a challenge which calls for the courage to dream, the courage to believe, the courage to dare, the courage to do, the courage to envision, the courage to fight, the courage to work, and the courage to achieve. To achieve the highest excellencies and the fullest greatness of man, dare we ask for more in life," unquote. Go forth with courage, accept the call to tackle great challenges, and embrace the opportunity afforded by these challenges that will most surely come your way. Take what you have been given through your education at Ensign College of Public Health and make the world a better, healthier, happier, and more prosperous place. Quite simply, be noble and great. I am confident that this is exactly what you will do. May God bless and give us all the fortitude to soldier on to greatness. Thank you.
Thank you, Professor Alda, for that address. We will take a short musical interlude, pre-recorded. I think we'll just go ahead. We will take goodwill messages first from the alumni representative. I don't know if their president is here. If their president is not here, their representative. Alumni, okay.
Thank you. The chairperson, Dr. Leonard Gay, the members of the Board of Governors, kindly permit me to stand on the existing protocols. Ladies and gentlemen, it is with great pleasure that I stand before you on this august occasion to address you on behalf of the Ensign College of Public Health Alumni Association. The chairperson of the association, Ms. Josia Mankwa, would have loved to be here to deliver this speech, but due to circumstances beyond her, she is unable to. I am Mr. Jerry Selassie Sifa, the General Secretary of the association, and she and the executive has directed that I present this message on behalf of the alumni. Our heartfelt congratulations to all graduating students. What a joyous moment it is to witness the graduation ceremony of the class of 2020. A few years ago, all of us who call ourselves alumni of the Ensign College of Public Health were in your shoes. After 2 years of hard work, perseverance, endurance, just to mention a few, we were able to succeed. Ladies and gentlemen, success in the MPH program can be attributed to several factors. To begin with, success in this program is achieved with the help of a committed teaching faculty and staff who were there for us at all times. This, I believe, was the same for you. The alumni extend their heartfelt gratitude to the able staff and faculty of ECOPH for the high standards of teaching they provide for students. Secondly, you may agree with me that your success in this program was due to teamwork and coordinated efforts among yourselves as students. One thing we have come to learn as past students is that no one can make it all alone. Group studies, group discussions, and other joint assistance from colleagues helped. We must tell you that it does not end here. As you might have learned, the public health program draws on expertise and knowledge of multidisciplinary approach to solving public health problems within communities. Therefore, do not be surprised to see the application of teamwork in the future as you work to improve the health and well-being of society. Lastly, and above all, we believe that your success in this program was due to your own innate and intrinsic motivation to help improve the health and well-being of society through effective leadership. We urge all of you to keep that desire burning, for it is this intrinsic desire and motivation that will lead you to greatness in this great profession. As an alumni association of this noble institution, we invite you as friends to be active and involved in the welfare and future of this great institution. We invite you to seek the welfare of the college that has given you so much in terms of knowledge and expertise. As Narayana Methi, an Indian businessman, put it, nobody is bothered about an institution more than its alumni. Hence, no group can make this institution greater than the alumni. May we commend the undying efforts and generosity of Dr. Mrs. Leonard Gay, the founder and the board chair. We love and appreciate all of you do for us. We believe that more can be done as the alumni become one with the interest of the institution to promote the public health within this country and abroad. Echoing the words of Chief Nada, an industrialist and philanthropist, a founder can carry an institution only so far, then the alumni have to step in. That's how an institution becomes one. We believe that with your participation in the activities of the alumni organization, we shall accomplish great things together. We will end here by once again expressing our love and well wishes to all of you. Congratulations, Cohort 5. Thank you. Aiko.
Thank you, Jerry Sifa. I still remember you from your days back. We will next take goodwill message from the National Accreditation Board. Today, we have the Senior Assistant Secretary for Accreditation, Ms. Asafweje, to give us the message on behalf of the Executive Secretary. Thank you.
The chairperson, Dr. Lynette Gay, and members of the Board of Governors, Ensign College of Public Health, Provost, College of Health Sciences, Professor Christian Ajari, representing the Vice Chancellor, Kwame Nkrumah University of Science and Technology, the keynote speaker, the Managing Director of the Nyaho Medical Center, Dr. Elikem Tamaklo, all invited municipal and district directors of health services in Ghana, heads, friends, and representatives from various tertiary and partner institutions, representatives of the University of Utah, faculty, staff, students, and alumni of Ensign College of Public Health, graduates, distinguished invited guests, ladies and gentlemen, I bring you greetings from the Executive Secretary, the members of the National Accreditation Board, and members and management and staff of the board. I want to just share a few words. Personally, it's my first time coming to this campus. I use this road a lot because I travel to Hohoi several times in a month, and I always admire this place. And so when I entered yesterday and got here, I thought, wow, this is really a truly beautiful campus. It's nothing like what you see from the road. And actually coming in and experiencing the ambience, the environment is beautiful. I love it. And I hope you will continue to keep it as beautiful as it is and maybe expand it and make it, you know, I think it's, for this road, is the best thing along this road, and I think it should be maintained. So I just want to say that the NAB has, over the last several years, seen you grow, and we wish to commend your board of governors, your management and staff for indeed initiating such an initiative and maintaining a very high international standard. And we wish to say that NAB is available and is there to encourage you to keep maintaining and actually improving what you have now. And to the graduating students, you have made it. 2 years of very hard work, a year of COVID coming suddenly and stopping everything in its midst. Congratulations. And I wish you all the best in your future endeavors. You are going to be exceptional leaders, and I hope that what Ensign has done for you, you're going to take it out into the world and prove that you actually attended Ensign College of Public Health. So I just want to say that NAB is proud to be associated with a college like Ensign, and it's a great pleasure for you to invite us here and an honor to witness this ceremony. Thank you very much.
Thank you. Next, to give the goodwill message is our own Professor Ajumain Bedu Akosa. He is the Vice Chair, Board of Governors. Professor.
The chair of the board of Ensign College of Public Health, members of the board, the president of Ensign College, guest speaker, representative of the Vice Chancellor of KNUST, provost of the College of Health Sciences, distinguished ladies and gentlemen, invited guests, graduates. You are a batch that can never be forgotten. The 2020 batch, COVID notwithstanding, you have completed your 2-year program and you're going into the world with COVID and post-COVID. That world can never be the same. And what better program to enter into the world than as a public health graduate? You know, and therefore you can anticipate from now onwards. We'd waited for almost 100 years. And smart people knew that something like this was going to happen. And those who gave advice, I suppose it was almost like election prophecy, nobody believed them. And then we were hit and hit hard. As you go into this world, your work is probably the most important work ever. COVID has made everybody understand that life is unimportant without safety and good health. Is that not so? Anything else has paled into insignificance. What is important in this world is health and safety. And are you not graduates of health and safety? So you are best placed to go into the world and make the world a better place and a safer place. You also must consider yourself very fortunate. I had a representative from NAB say that you have been educated in a campus like no other in this country, Ghana. And I have said, and I will say this again, that if you have not passed through Ensign, you are incomplete. Now, graduates of Ensign, are you complete or incomplete? Of course you are complete. What else would you require? All others will have to pass through here to complete whatever they have done. So I would say, go forth into the world and make the world a safer and healthier place. Thank you.
Thank you, Professor Bedu Akosa. You see, we are doing well by observing the protocols. So, Madam Ness, thank you so far. Next, we will have a goodwill message from the representative from KNUST, Professor Christian Ejare. He is the Provost of the College of Health Sciences. Prof.
Thank you very much, Registrar. Before I read the speech from my Vice Chancellor, I would like to also add my voice to the NEB rep. This is my first time here, and I like the ambience. And since you are in your sixth year, I like your maintenance culture. I believe you are going to continue with that. And KNUST is also proud in mentoring you. We hope that we will continue to maintain our facilities like yours. Thank you. Now, since I'm representing my Vice Chancellor, I would prefer to go by the speech written by the Vice Chancellor. The Chairperson and Board of Governors, President and Management Staff, alumni representatives, Managing Director of Nyaho Medical Center, invited guests, 2020 graduating class, members of the media, distinguished ladies and gentlemen. I bring you warm greetings from Kwame Nkrumah University of Science and Technology, mentor institution for Ensign College of Public Health. Kindly permit me to apologize on behalf of the Vice Chancellor, Professor Mrs. Rita Akosua-Addison, who should have been present at this August ceremony, but have to be absent because of other official university assignments. She, however, sends her regards and wishes you a very successful fifth graduation ceremony. On this note, I want to say that I'm delighted to be part of this graduation ceremony, which is the fifth in the history of the college. I'm also congratulating you and then the graduating class who have successfully gone through your courses of study and are worthy of being awarded degrees. This year has been challenging, as previous speakers have alluded to, for you to go through your studies. But a crucial one for people in the health sector is very, very significant. These circumstances makes this a feat, a very commendable one, and this goes to confirm the level of sacrifice you have made to ensure and also endure to see today's ceremony come into realization. KNUST, your mentor institutions, has been able to organize its graduation ceremony in these challenging times, of course, through the virtual means. You are combining the two. And we are glad that you have been able to do the same. As one of the private institutions affiliated to KNUST, we are also proud of your exploits in terms of your programs, content, research output, and skills that you've been able to go through during this Master of Public Health program. We are pleased about your achievement, and we pledge our unflinching support in any way possible to aid your advancement. Chairperson, please permit me to give a word of advice to our graduating students or graduates. As public health experts trained at Ensign College of Public Health under the supervision of KNUST, it is expected of you to keep up with the enviable reputation out there, especially in this season where the world is faced with global public health pandemic, COVID-19. However, I believe that with the skills and the training you have acquired through this noble institution, you are well equipped to help our dear country and the world in fighting the COVID-19 pandemic by providing necessary solutions and interventions. Above also puts a lot of responsibilities on your shoulders as graduates of this college, owing to the fact that the society is aware that you have been adequately resourced to bring relief to the bottlenecks in the health sector of this country. It is therefore behooves on you to live up to expectation. Let your positive impact be felt in your field of work, and together with other well-meaning Ghanaians, let us all move Ghana to an enviable position we can all be proud of, especially in this era of COVID-19. I wish you all the best in your endeavors. Thank you, and God bless us all.
Thank you. The chairperson, Dr. Mrs. Gay, with your permission, I will want to introduce our keynote speaker. Our keynote speaker is the Managing Director of the Yahoo Medical Center, a leading healthcare provider in Ghana and the first group medical practice in the country. Since 2015, he has driven the digital transformation of the hospital, as well as the accreditation of the hospital by the Ghana College of Physicians and Surgeons to train family physicians. He launched the Healthcare Forum in 2015, an annual forum bringing together key decision makers from the public and private sectors to promote quality and safety in healthcare. He has won many awards, including the AABLA Young Business Leader of the Year 2018, and the Ghana Entrepreneurs Foundation 2015 Young Entrepreneur of the Year. He holds a Bachelor of Medicine and Surgery from St. George's Hospital Medical School in London, and a diploma in tropical medicine and hygiene from the Liverpool School of Tropical Medicine, among others. Ladies and gentlemen, may I invite Dr. Elikem Tamakru to give his keynote address. Dr. Elikem.
Good afternoon. It is a pleasure to be here, and all the sentiments that have been shared about your campus, absolutely right. I'm very impressed. My first time here as well, and it's been a pleasure. So to the chairperson and members of the Board of Governors, Professor Christian Ajare, Provost, College of Health Sciences, representing the Vice Chancellor of KNUST, the Executive Secretary, National Accreditation Board, the Registrar, members of Convocation, parents, guardians, and sponsors, staff, students, alumni, graduating students, invited guests, distinguished ladies and gentlemen. It is a special honor to be invited to give the keynote address at this 5th graduation ceremony of Ensign College of Public Health. I would like to thank Professor Stephen Alder for the consideration shown to me in speaking to the graduating students of this commencement ceremony. I would also like to especially thank the founder of this institution and chair of the Board of Governors, Dr. Lynette Gay, and her husband, Robert Gay, with whose efforts and guidance allows us to be here today. As I've learned a bit more about the mission, vision, and values of Ensign, I think that what has inspired me the most has been your commitment to improving health and well-being in Ghana, in West Africa, and throughout the world. And the way you're doing that through developing community-orientated public health professionals who are encouraged to be future leaders, advancing the science and the practice of public health, has been inspiring because there is a need for leaders in this world. The events of 2020, with the global COVID-19 pandemic sweeping across every community in this world, reminds us that this is an ever-changing, extremely complex and interconnected world. And now, more than ever, the call for globally minded, ethical, considerate leaders who are impacting their local communities and serving the vulnerable and the empowered alike is actually a call that grows louder as the fractures that we see in our systems, our governments, our healthcare systems, are exposed and are stressed even to the detriment of the beneficiaries that the systems were built to serve. So as I look at you, and as I was writing this, I was imagining you. What I am looking at is potential. I'm looking at the problem solvers. I'm looking at the change agents. I'm looking at the system builders and rebuilders, the advisors, the influencers, the decision makers, and most importantly, the giants that have been stirred over the last 2 years and who have been equipped with the skills and the resources and the connections to break through the barriers that prevent change in our developing economies. And the inspiration and the aspiration to correct the injustice of the past and offer every citizen the right to good health and well-being, the right to work and be productive, and the right to offer future generations a legacy to build upon is one that you now have a mantle, and is one which I wish you the very best as you move from today onwards. At this point, I would like to speak a bit more naturally and speak from my heart, and talk about my lessons in leadership through my years in Ghana and also outside of Ghana. And there are 3 main points I would like to leave with you. The first is a story about Nyaho Medical Center and the founder, my father, the late Colonel Dr. Kian Tamaklo. He was born in 1927 when Ghana was still under colonial rule and was one of the first doctors, or the few doctors who were trained in Dublin, to come back into our country. He came back in 1955, right before independence, and was sent to Congo. He was sent to a lot of different places that were going through independence, and came back to be the first Ghanaian to lead 37 Military Hospital. He then was promoted to be the medical director of the Ghana Armed Forces. And it was in 1969 that he left the Ghana Armed Forces to start the private sector role, which was to build the first group medical practice in Ghana. And when we talk about group medical practice, a lot of people hear the word, but it basically means bringing specialists of different fields, different expertise together in one place. In the past, people were doing their own things, individual doctors, and so Nyaho was not the first clinic. but what it did was to bring people from different backgrounds in one place. And so this year we celebrate 50 years. And in Africa, Ghana being 63 years, it's actually a testament of the way we were founded of teamwork that allows us to be here today. Because when the founder died in 2001, his wife picked up, but she was not the one driving it. She was non-medical, but there were many people who held this organization together. So as I came into the organization in 2015, the thing I was taught was to honor those who've gone before you. In any situation you go into, there are people who have sweated, who have toiled. It might not be a perfect situation, but definitely something happened to bring it where it was. And so when you come in, you stand on their shoulders to change. And so the first lesson I would like to leave with you is to honor by building and changing and improving. The second thing for me growing up was that everyone knew my father. He was extremely well connected because of just his character. He loved people. And so there was a lot of pressure for me to come back and be a doctor. And when you're a child, I mean, it's a bit nuts, if you don't mind me saying, that you would automatically come and run a hospital. I mean, how do you do that? And I run away. Honestly, I wanted to live my life. So even though I was accepted to many schools, everyone thought it was because of your father. I decided to go to the UK just to build my own name. And I'm extremely glad I did that because it was difficult. Where we were, I was in St. George's, was actually a unique organization because it was a pioneering organization. And I met so many people. But what I learned was communication skills, working with people who are very different from me. One of the uniqueness was a great school of Muslims, atheists, and Christians, and people debating about life. At the same time, you have professors and the best creators who are also different, who have different opinions about science, debating. And this issue of debate taught me that you should not be afraid of people who have different opinions from you. However, by listening, by taking something from the conversation, it actually empowers you. And so as I went into emergency care in the Royal Liverpool Hospital, I thought I was going to go to save the world by being an emergency physician. And you heard about me doing a diploma in tropical medicine and hygiene. Unfortunately, like Professor said, I've not gone through Ensign, and so I know that I'm missing out. But I did learn something from the Liverpool School of Tropical Medicine. And one thing I learned was really that any community you go into has people that you need to listen to. You might go in with your own ideas, but even those ideas are not enough. It still needs partnership. And so in going out, I thought I was going to save the world by doing something great, until I realized and I was humbled that in my own country, in my own home, in Nyaho, as my mother was retiring, there was a need for succession, a need for someone to come in and take the organization, not to do decisions based on profit, but to make decisions based on the community, because the community needed a longer-term approach, not just a short-term win or short-term gains. And so I came back to Ghana to take on the role, and it was my decision, not because of who my father was, not because of anything I was told, but at the end of the day, I prepared myself for this role, and I came in knowing it was not going to be easy, and it has not been easy. But the second lesson I would like to leave with you is to find your own path and find your guiding light of inspiration. There'll be many people who have desires and wishes of you, and that is great. You should definitely use that as energy. But it is your life, and you've been called to a life of impact. Finding that is important because the challenges will demoralize you, and you need to find an internal motivator. Money will not do it. Success will not do it. The accolades will not do it. It has to be something from within you that will inspire you through the difficult times. And that's the second message I'd like to leave with you. The last one, and when you hear about the themes of teamwork and partnership, is really around this year. Because as Nyaho was built on teamwork, we built partnerships, government, ministries, Ghana Health Service, other private entities. We don't work on our own. And I think that as I've come in this organization, in 2020 with COVID, it so happened that on the day that we had opened our PCR lab, we were the first private organization to do COVID-19 testing in Ghana. And this was actually, there were no guidelines for laboratories. And it was a vastly changing thing. On the day that we had been approved, I was called to the ministry, and that's the day I found out I had COVID-19. I was feeling unwell, so I did not go. But because of our lab, because we are tested within 48 hours, I knew my condition, I knew the diagnosis. And the difficulty was that we had to do a lot. In May, June, there was a lot going on. But our board of directors, and you have a board of governors, and any organization that has to go through long term needs people who are watching the bigger picture. And I think that's a testament of this organization. But as you are going in, I realized that I could not do it on my own. I could not do the speaking engagements. I could not inspire my team. My team were demoralized because they didn't have a lot of help. And I could not do a lot, but because of the partners that we had developed over time, because of partnership, I was not alone. In the morning at 7 a.m., we had a board meeting. At 10 o'clock, my executive team were leading the organization. I had to be with my family and take them through because my whole family was affected. And I had to do a video. And that video was to speak to all the different people who were saying different things because it was a very political time. But that video became viral and went throughout the airwaves. And the thing was, what I learned was that when you have people around you, you get good advice. And you might not see it at the time, but the advice that your people, your boards, your friends, your family, your advisors take you through the difficult times. And I can say to you now that NYAHO is the only private organization that's doing both COVID testing and COVID treatment in Ghana. Now, as a private sector player, we've done it with partnership with our district, with partnership with the Ghana Health Service, with partnership with the FDA, Ghana Standards, with private sectors. And when I look at your brochure, I see that this organization has this as an ethos and a value of partnership. So my last message to you is that if you want to change the world, you cannot do it by yourself. You will need to find partners. And I believe that even amongst you right now, all of you are going to be, in 10 years' time, you're going to be leading great organizations. I believe that. And all of you, this cohort and your alumni, this is the first partnership, the first group that you need to keep the relationship. Because when the tough time comes, you will draw on their shared values, you will draw on the shared vision. And I really wish you the very best. So I'd like to leave you with this quote that my father used to speak to me. The heights reached and kept by great men and women were not attained by sudden flight, but they, whilst their companions slept, were toiling upwards through the night. Thank you and have a great future.
Thank you so much, Dr. Tamakru. We will continue with the ceremony. We have got to a very important part. I will want to alert the head of the program, Dr. Manote, Chair of the Board of Governors, Mrs. Lanit Gay. With your permission, I call on the head of the Public Health Program, Dr. Stephen Manote, to present the candidates who have fulfilled the requirements for the award of a degree to be admitted to the said degree. Dr. Manote.
Will the graduating candidates of the School of Public Health please stand and remain standing? Vice Chancellor, KNUST, I have the honor and privilege to present to you graduates of the School of Public Health here in present and those unavoidably absent for whom I stand proxy, all of whom have fulfilled the requirements for the award of a postgraduate degree to be admitted to the third degree of the Kwame Nkrumah University of Science and Technology. Thank you.
I, Professor Christian Ejari, Provost, College of Health Sciences, representing the Vice Chancellor, Professor Mrs. Rita Kusuya Dixon, formally admit you into the Master of Science degree in Public Health of the Kwame Nkrumah University of Science and Technology, Kumasi, Ensign College of Public Health, AICO.
Graduates, I will now, with the permission of the board chair, call out your names, and you will be hooded and presented with the scrolls. Professor Ajiman Bedu Akosa will do us the honor of hooding you. I think we had a rehearsals this afternoon, and you know the path to take. So here we go. Rebecca Tricia Morrison. Okay. Victoria Nati Lawe. David Myers Bani. Doreen Adjoa Afiye Bechi. Nathaniel Afum. Lydia and Moki Deborah. Lucy Ofori. Abigail Laja Mana. Maximiana Dati. Jonathan Yabua. Henry Okori Ukoji. Collins Marquis Colley. Sylvia Kweku Doche. Cynthia Naughty. Onyema Obi Ike. Mabel Adom. George Opel Menu. And finally, Isaac Ampedu. You all heard the loud applause when Isaac was mentioned. It's just by some strange occurrence, his name is the last here. They know what he stands for, but he will always be on time anyway. All right. May you be seated. The chairperson of the Board of Governors, with your permission, we'll go on into the next stage of proceedings. It is now time for students' recognition. This is a time when we recognize the achievements of students. And this year, a number of them have excelled in specific areas, and we will want to recognize them for their efforts. Madam Chair, for the first recognition, this year we had the Springtide Investment Company in the USA coming on board to give scholarships to deserving students. In all, for this year, 7 students were awarded scholarships, which went directly into payments of tuition fees. At this point, we will want to recognize, especially in this year, in the graduating class, those who received the scholarship. But before that, let's take a message from the founder and managing partner of Springfield Investment Company in the US.
This was the dream of Robert and Lynette Gay as they began plans in 2011 to build a world-class school of public health. Fortunate to find a partner in Kwame Nkrumah University of Science and Technology and the University of Utah School of Public Health, Ensign College of Public Health was created from funds donated by people who also believe in the desire to raise healthcare standards in West Africa. Ensign College is situated
Good afternoon.
on a beautiful piece of
My
land
name is Austin
adjacent to the
Walters.
Volta River.
As founder
The
and
college
managing
not
director
only
of
designed
Springtide
to be
Investments
aesthetically
based in
pleasing,
Boston,
but also
United States, it is my pleasure to congratulate the Ensign College Class of 2020 and present the Springtide Scholarship Awards. As a US-based investment firm, Springtide is constantly looking for breakthrough technologies and businesses that will change the healthcare landscape. Underlying each technology and business are individuals, people with diverse experiences, new ideas, and the drive to solve problems that are widely held, acutely felt, and poorly addressed by other solutions. Our real investment has always been. Good afternoon. My name is Austin Walters. As founder and managing director of Springtide Investments based in Boston, United States, it is my pleasure to congratulate the Ensign College Class of 2020 and present the Springtide Scholarship Awards. As a US-based investment firm, Springtide is constantly looking for breakthrough technologies and businesses that will change the healthcare landscape. Underlying each technology and business are individuals, people with diverse experiences, new ideas, and the drive to solve problems that are widely held, acutely felt, and poorly addressed by other solutions. Our real investment has always been and always will be in people. For this reason, we have decided to invest in select students at Ensign College of Public Health in Ghana by awarding scholarships. Each of the recipients has demonstrated high academic standing and great potential to leverage their master's in public health degree to great impact in their work and communities. We commend these recipients, as well as the entire Ensign College student body, for seeking out the highest standard in public health education. We challenge all who pass through Ensign College to seek out solutions to the yet-to-be-solved problems. We challenge you to act with honor and stewardship in all your places of responsibility. Most of all, we challenge you to be unrelenting in your efforts to improve the health of your families, workplaces, communities, and countries. Congratulations, Ensign Class of 2020, a most memorable
Springtide Scholarship at Ensign College of Public Health, awarded to Henry Okori Ugoji, MPH Class of 2020, for outstanding scholarship and personal drive to solve problems that are widely experienced, acutely felt, and poorly addressed by other solutions.
Henry will be back again, this time just to have the recognition from the Vice Chancellor's representative. You'll just come back and he will give you whether it's a leg shake or an elbow shake. Now, in 2020, there was a competition, more or less, organized by the Association of American Public Health Institutions. It was open to all students all over the world who are doing public health or who are members of the American Public Health Association. And Henry put in his bits, and finally, when the award was given, the whole world, it came to an enzyme students. So he won the 2020 Association of American Public Health Institutions grant of $1,000. He has taken his money already, so he will just come and he'll be recognized by the Vice Chancellor representative. Henry. Congratulations. Next, student recognition. I will invite our senior lecturer, Dr. Ruben Essena, to do us the honors. The Community Service Award, he will speak briefly to it and mention the person who is coming for the award. And also, we will have one. Okay, Dr. Essena. First is the Community Service Award. And then you also look at the best project or thesis. Community Service.
All right. Ladies and gentlemen, is the Community Service Award. Now, this awardee worked on several public health projects. First, with a non-governmental organization, Total Women Network, which is aimed at empowering and educating and inspiring women, especially the girl child. She also worked with the Mission Outreach to Africa, a non-governmental organization, which is aimed at organizing health screening, treatment, and referral to health facilities where appropriate. Then, as Assistant Health Coordinator, Then, as Assistant Health Coordinator and leader of COVID-19 Task Force of the Church of Pentecost in the Ansuman area. Then it also includes education and ensuring adherence to COVID-19 protocols in over 40 assemblies since the inception of the pandemic. She also solicits funds to purchase PPEs to inmates of Accra Psychiatric Hospital. Ladies and gentlemen, welcome Dr. Abigail Mana. Okay. Thank you. Now, the awardee of the best thesis. She worked on determinants of induced abortion among women in reproductive age at Mary Stopes International Center of Excellence in Greater Accra region. Ladies and gentlemen, welcome Tricia Rebecca Morrison. Okay, thank you.
Best Thesis Award 2020, Rebecca Tricia Morrison. Thesis topic, Determinants of Induced Abortion Among Women in Reproductive Age at Marie Stopes International Centers of Excellence in Greater Accra region of Ghana. Signed by the President and then the Chair of Board of Governors. Congratulations.
The last recognition for the day is the board chairperson's prize. Professor Akosa will do the honors of presenting this award. This award goes to the overall best graduating students. She had the highest grade points. I will not mention it. I will not mention the grade point, but it was the highest for the class. And she is being recognized for all the hard work she put into her studies. Let us all welcome Rebecca Tricia Morrison. Well done, Tricia. On the program, we have musical interlude. I will skip that because the last time they were unable to play, just to also make up some time. So we move on straight to the administration of the public health oath. Of course, these are public health students, and just as the medical doctors take their oath, we also expect our students to take the public health oath. To lead in this is Dr. Stephen Manote, who is the head of the academic program. Dr. Manote, the oath can be found in the brochure, page 21. Dr. Manote. Please stand.
Thank you, Mr. Kumar. Will you please recite this right after me? Today, as public health professionals, we solemnly pledge ourselves as guardians of the public's health. We commit ourselves to practice our profession with conscience and dignity, without discrimination or arrogance. We pledge to respect the information shared with us. We promise to maintain the ardent and noble tradition of our profession. We hold with honor our worthy colleagues as our professional family. We vow to use our expertise only to alleviate suffering and cultivate well-being. We swear to respond when called, knowing that at times we place ourselves at risk in order to serve those in need. We proclaim our duty to educate the public about the threats to health. We are affirm to advocate for those whose voices cannot be heard and those whose needs have not been served. We seek to discover new knowledge and bridge the divide that separates us and elevate the lives we lead. We promise to teach and mentor those who follow us, for they are the future of our caring profession. We make these promises solemnly, freely, and upon our personal integrity. Thank you.
Please take your seat. Of course, now that we know who the best graduating student is, the chairperson, please permit me to invite the overall best student to give the valedictory speech. Rebecca.
Chair of the Board of Governors, board members of this noble institution, President Alda, Vice Chancellor, KNUST, the keynote speaker, registrar, faculty and staff, colleague, graduates, our lovely, wonderful, and supportive parents, invited guests, ladies and gentlemen. Thank you so much for the opportunity and the warm welcome. When I received the call informing me to give a speech on behalf of the graduating class, I felt deeply honored. Not because of the personal recognition, but the opportunity to represent my gallant colleagues and graduates. Indeed, the honors being accorded us today did not come on a silver platter, but only by dint of extreme hard work and individual sacrifices. I therefore want to take this time to acknowledge all my colleagues, for the unprecedented effort invested in achieving this academic laurel. Can I have my colleagues upstanding and a round of applause from all gathered? Thank you. Indulge me to share a narrative of our story. 2 years ago, please be seated. 2 years ago, we converged on this campus, a diverse group of young men and women with individual ambitions to pursue this program and become public health experts. There was shared excitement within the group by virtue of gaining admission despite the competitive admission processes. By the middle of the first semester, this excitement had reduced drastically, with reality dawning on us. The overwhelming pages of materials we have to read, the volumes of assignments, numerous coursework, plenty presentations, not to mention the interim assessments. The interesting thing was majority of us were mature students and had to combine this with our regular work. We were, however, determined to succeed, and we realized rather early that we had to support each other and share our pooled resources and expertise. I am happy to say this contributed immensely to our collective success, with majority of us graduating with full honors. We have become friends and family despite our diverse backgrounds, and learned beyond the academic work the value of interdependence. We have also solemnly pledged to be worthy ambassadors of this great school and to carry with us the spirit of hard work, industry, and teamwork as we explore the limitless opportunities ahead of us. Ladies and gentlemen, our success story will be incomplete without acknowledging the contributions of key pillars of support throughout this period. We appreciate the kind mercies of God, which has been enduring throughout this rigorous course of study. On behalf of my colleagues, we want to especially acknowledge the support of our parents, spouses, and loved ones who have stood behind us through thick and thin. It has definitely not been an easy road, but definitely a thrilling roller coaster, and you deserve the honors as much as we do for your unrelenting support, especially in the tough times. Distinguished guests, Ensign College of Public Health does not only provide quality education, but also ensures that students are built socially, academically, and professionally with excellent work ethics. We are immensely grateful to the college for providing us with a conducive environment to learn from professionals of global standards. We would like to thank faculty staff of ECOPH for their dedication, influence, and guidance along the way. Of particular mention is the time invested by faculty and staff to ensure we had unlimited practical experience. To our teachers, we celebrate you, and to say we owe you a debt of appreciation is certainly an understatement. Thank you. For each of us, we have seen ECOPH shape, inspire, and challenge us, and introduce us to friends we will love and cherish for life. We have learned, laughed, loved, gotten into trouble, and most of all, matured together. The qualities we have gained over the last 2 years and the well-rounded people we have become have given us an advantage after we leave this campus. We are part of a very small percentage of college graduates who have been exposed to more than just textbooks and lectures. This quality will open numerous doors in the near future. I am fully optimistic that this graduating class will change the world through cutting-edge research in public health. But today is not just about ruminating on the past. It's also about looking forward into our future. To my colleagues, as we look into the bright future of the horizon, I'd want to share a single pearl of wisdom. As we enter new terrains, embrace change and be brave. Take risk. There is only one constant in life, and that is change. Get used to it and embrace it. Recognize change as a golden opportunity. Pursue opportunities, but if you realize later it doesn't meet your expectation, dare to make a change. Remember, every one of us is here today celebrating because we embraced change 2 years ago and took an audacious step into the unknown. We left our families, friends, and everything to come to ECOPH and see who we have become, wiser, more intelligent, and knowledgeable. Also, never stop being brave and taking calculated risk. That is where real growth occurs. Growth always occurs outside of our comfort zones. Our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure, powerful to take risk and succeed. I am proud to say that Ensign College has given us the requisite tools to succeed. The world is at our feet, and a great future beckons starting from this moment. Thank you.
Congratulations. Now I can safely say that we are gradually getting close to the end of the ceremony. Another important aspect is to acknowledge that you have become alumni of Ensign College. We would therefore want to use this opportunity to make you swear the alumni oath as well. This should be done by the alumni president or her representative. The oath can be found on page 26. So, Mr. Sifa, I think you will stand for the oath.
Kindly say this after me. I, a graduate of Ensign College of Public Health, Bonn, do hereby solemnly declare my membership in the ECOPH Alumni Association and voluntarily pledge to abide by its aims and tenets. I pledge to dedicate my loyalty and commitment to the development of ECOPH and to the service of the ECOPH Alumni Association. Wherever and whenever needed. So help me God. Congratulations.
Thank you, Mr. Jerry Sifa. One more item, and then we know you have now become fully graduated. I have observed that your tassels are on the left for some of you. You are still undergrads, really. You have not attained that status yet. So make sure your tassels are on the left, on the right, please. If yours is on the left, send it back. Okay. So we will now take the dispatch from the president. You will do this whilst standing, please. Professor Alda.
Thank you, Mr. Kuma. What an exciting moment, and so excited to have you formally as graduates. So let's get official about it. The Ensign College of Public Health has trained and prepared you for service to humanity. Therefore, on this 28th day of November, 2020, in the year of our Lord, I send you out into the world to go and make a difference in the local and international community. As a sign of your graduation, please turn your tassel from the right to the left. Congratulations.
Congratulations, congratulations, congratulations. Congratulations. Graduates, please sit. Thank you, Professor Alda. Announcements and recognitions. I will still want to remind you that we should still be observing the COVID protocols. I know along the line it is very easy to forget. But as human beings, once we are reminded, we will try to adhere to those protocols. Samuel? After the ceremony, all the invited guests, those on the stage, and those specially invited, we will be meeting at the President's house for some refreshment. students or graduates, we will also be refreshing you. We have set up umbrellas outside. You plus 2 of your visitors will also be refreshed. If you have more than 2 visitors, that is your own cup of tea. I saw one lady bringing an overload of relatives. Only 2 will be entertained. We will specifically want to recognize these personalities who have helped to bring this important ceremony to this stage. One special person here we want to recognize is Mrs. Irina Ofe. She's the Municipal Director of Yilo Krobo. Significantly, she is also the Vice Chair of the Institutional Review Board of Ensign College of Public Health. Without their reviews and approvals, their thesis work cannot progress. So she is an integral part of the ensign community. You are welcome. We also have Mr. He's not a Mr. He's a doctor. Dr. Philip Osafo Kwaku. He is the director of Akosombo Textiles Limited and a wonderful partner of the ensign community. You are welcome, Mr. Philip. Then, of course, we have already noticed Suzette Asafo Ejei, the Senior Assistant Secretary at Accreditation. She was here a while ago. You are welcome. Then, of course, we have the officers of the Pont Akuse Police Division. They are all here to give us protection. Thank you for coming. Thank you for coming. We have already interacted with Professor Jumambedu Akosa, Professor Christine Ejari, Professor Chirag Benyega. Yes, let me also introduce Mrs. Titiloye Kemi. She is the Senior Assistant Registrar, KNUST, in charge of affiliations. You are welcome. And of course, she was here with Mr. Matthew Amwako, also from KNUST. You see, they are also roped, of course, so they are part of us. We have our faculty behind. We have Mr. Macarius. We have Dr. Edith Tete. And then, I don't know the name you give to Dr. Sutherland. We have Dr. Sutherland. Oh, he doesn't have, okay. Okay, then the next person, I know you surely have a nickname for him. Our senior lecturer, head of the program, Dr. Stephen Manoti. Of course, we also want to thank Dr. Elik Tamakru. If I have not mentioned your name, please forgive me. My assistants have not brought that to my attention. But I know you are here and we do recognize you for coming. Thank you very much. The Chair of the Board of Governors, it is now time for us to dissolve the congregation. So, Dr. Mrs. Lynette Gay, you have been with us from the beginning up to this time. Kindly proceed with your closing remarks and dissolve the congregation. Thank you.
Thank you, thank you. I can't not see you on my screen, so please let me know you can hear me. But I just want to tell you graduates how beautiful you look in your robes. Not being there to shake your hands or give you a hug or a big smile is it's sadness for me today, and yet it's a beautiful, beautiful, joyful day. And your blue robes remind me of the Volta River behind you. And so I love seeing them on you. I want to thank President Alder and Dr. Tamaklo for their remarkable remarks. Truly great wisdom and direction. And I'm so grateful that I was able to hear those, as well as those others who have spoken today, particularly Rebecca, about Victoria's speech. Thank you for your words of wisdom as well. I will make this short, as I know people want to get to celebrating, but 2020 has been quite a year of contrasts in every sense of the word, I think. This is not a year that I would like to repeat, and yet I'm not sure what I would change because of all that I have learned and the blessings that have come from the challenges over these past 9 months. I like what the Roman philosopher Seneca stated: a gem cannot be polished without friction, nor a man perfected without trials. So I think we may all be a little more polished, prepared, and a bit more perfected from what we've been dealing with this year. 2020 will not be forgotten, but I hope we can look back on it with also great gratitude in the things we've learned from the challenges we've gone through. Graduates, the gift of hardship and the gift of gratitude seem to go hand in hand. Just as in nature, we see examples of resilience, even in times of calamity, such as with a raging fire that sweeps across everything, destroys it. When all seems lost and the destruction seems complete, sprouts showed up from beneath the charred field that remains. Life goes on, stronger and more resilient. These are examples that we see all the time around us. Resiliency and a new sense of direction come when we are fighting things that are difficult and the unknown and scary to us. Just look at each of you, what you have accomplished in spite of the challenge that have come with dealing with the onset of COVID and changing all around us for this year. The shifting changes and rapid adjustments made by each of you were remarkable. I remember the many conversations that we had on our board calls of how you graduates were responding so adeptly and so quickly and so positively to that which is required and asked of you. Instead of throwing up your hands and stopping your education, you continued by shifting to online classes in less than a week. It's also a remarkable example of maturity and resiliency with which the faculty and staff were able to put all classes and instruction online within just a few days and without missing a beat. You overcame this very real challenge, and you will be able to do it again many more times as each of you go out into beginning your new adventures and in your careers. These examples fill me with tremendous gratitude and appreciation for each one of you and your ability to take the hardships and turn it into this beautiful graduation accomplishment and ceremony. Congratulations to each of you for the many, many accomplishments you have achieved. And I would like to just touch on the three points that I have written down here from Dr. Tamaklo. Honor by building change, improving upon those who've gone before you. Find your own path. Find a motivator for impact during difficult times, because difficult times will always come, as Rebecca said. Change is inevitable and change will always come, but look at it as a challenge to better yourselves, lift yourselves, and improve everything around you. And then you will need to find partners and partnerships that's so valuable on a personal level, on a family level, a community level, and professional level. Partnerships are invaluable, and relationships stay with you forever. So I would like to second those things that he has said as well. I would also like to quote Professor Alder, President Alder, Dr. Alder, be noble, be great, and would ask that each of you stay blessed at this time, and that as you go out into this world, that is a wonderful world and will continue to be so with your talents and your strengths and the ability you have to affect change, uplift, and have a great impact wherever you will go in the future. May you stay blessed, and may you strive to bless those around you in all situations and at all times. And may God go with you always. I'm very, very thankful and grateful for all of you and being able to spend this morning, this afternoon with you. Thank you. And it now will be my privilege to close this ceremony. By the authority conferred on me, I, Lynette Gay, founder and board chair of Ensign College of Public Health, declare this assembly duly dissolved. Thank you.
Thank you. This will be performed by Curtis Kondia.
Shall we please be upstanding as we take the closing prayer? To you be all the glory and all the honor, Lord. Indeed, this is your doing, and it is marvelous in our sight. You who began these good works in us has surely brought us to completion. It has not been easy, but your promises and your grace has kept us through. We thank you for a successful ceremony. We thank you for a wonderful school. We thank you for the wondrous things you are doing with us. We know that there's never been a time when the world needed public health leaders as this time when there's an outbreak and a pandemic. And with the values of servitude, values of altruism and selflessness, and values of obedience and neutrality and honesty, we know that we are going into the world to make impacts. We are going to be good ambassadors of this college. We are going to be good representatives of empathy and everything that Ensign stands for. And indeed, these are also values that the good book or the Bible also stands for. And so we know that we are charting a good path and we are on a good course. And so help us, God. We pray and commit every other person here, our board of governors, all invited guests. We pray that you take us back home safely and help us to excel in every endeavor of ours. In Jesus' name, I've prayed with thanksgiving. Amen.
Let's remain standing as we take the national anthem. We will take the national anthem now. One other piece of announcement, we will remain standing as we recess. But for the information of the graduates, your certificates are ready for collection today. Right after here, before you leave campus, you can come to the registry and collect your hard-won certificates. Those who know they can take their certificates know themselves. If you know you can take your certificate, come to my office. If you know you can take your certificate, come today and you will get it. If you know you can't take your certificate, don't come. Okay, so keep standing as we recess. Thank you.
Thank you.